Systems is a high-caliber group of national curriculum, training, and education experts coupled with leading-edge technologists in both software and hardware-based simulations. Drawing from our diverse breadth of professional knowledge and experience, our industry-focused teams develop high-value, low-cost, and easy-to-deploy learning systems. Our Curricula VR platform is engineered to disseminate fully immersive, high-velocity, mission-critical virtual reality learning simulations. And our programs are optimized to empower students and to provide educators with the data they need to document the achievement of learning outcomes and skill-based competencies.
Okay, students, so the charge nurse just advised me there is a patient with a possible heart attack. We can stand here and observe what's going on, but we need to stay out of the way because everything is going to happen very quickly.
Oh, my chest hurts so bad. It feels like someone is sitting on my chest.
Hello, Miss Smith. I'm Natalie. I'm one of the nurses on your treatment team. We are working to help you, but first there are a few things we need to do. First, we have to get a 12-lead ECG, meaning a picture of your heart. We'll show that to Dr. Fred and the cardiologist for review. While the tech is doing the ECG, I will start an IV and draw some blood to send to the lab.
So from what I can see on the monitor and the 12-lead ECG, it looks like Mrs. Smith is having an MI, meaning a heart attack. This occurs when the blood flow to certain parts of the heart is slowed or stopped, causing damage to the heart muscle. According to recent information from the American Heart Association, roughly 735,000 heart attacks occur in the U.S. yearly. So knowing early warning signs and obtaining timely diagnosis can increase the chances of survival and recovery. What are some of the early warning signs? They can be different for everyone, but the typical symptoms are complaints of chest pain or tightness or pressure that lasts for several minutes, nausea, vomiting, heartburn or indigestion feeling, stomach pains, diaphoresis, meaning cold sweats feeling. They can have sudden dizziness or lightheaded feeling. Pain that may radiate down the left arm, maybe across the chest or to the neck or the jaw or to the back, and some complain of shortness of breath or difficulty breathing. Great. So the labs will be drawn on the patient. What labs do you think they'll need? I believe they will need to draw a troponin level to detect heart muscle damage and a creatinine kinase, an enzyme specific to the heart muscle and to the basic chemistry panels. Yes, the main component that Dr. Fred will look at this time is the ECG. Dr. Fred will specifically look at the ST segments on the 12 lead. This will help Dr. Fred confirm the diagnosis and tell him where in the heart the blockage is and whether it is a partial or a complete block. The ECG will be sent to the cardiologist for review, and they will determine whether there is a need for cardiac catheterization or not, Dr. Fred is going to talk to the patient now. Let's listen.
Mrs. Smith, hello. How are you feeling?
Oh, I feel like someone is sitting on my chest. What's going on? Am I dying?
Dr. Goodhart, the cardiologist, and I have reviewed your EKG, and it looks like you're having a heart attack. We're going to give you some medications and then send you to the cardiac cath lab where you will meet Dr. Goodhart and his team. They will explain to you what the procedure is and how they will correct the blockage you are having in your heart.
So Dr. Fred has advised the patient that she is having a heart attack and will need a cardiac cath, meaning Mrs. Smith will have a procedure that allows the cardiologist to see the blood flow to the heart muscles. Dr. Goodhart will either go in through the patient's vessel in the wrist or in the groin. He will insert a long, narrow tube called a catheter into the vessels and guide it into her heart. This is done with a special X-ray machine. When the catheter reaches the heart, Dr. Goodhart will inject contrast dye into the vessels. This will allow Dr. Goodhart to see Mrs. Smith's valves, coronary arteries, and heart chambers. Dr. Goodhart can determine where the blockage is and then repair it with either angioplasty and or stents. For next week, I would like you all to look up what the risk factors are for cardiac catheterization, what medications are normally ordered and given to the patient before going to the cath lab, what angioplasty is, how it works, and what exactly it does. Also, review a cardiac stent, what cardiac stenting is and what it does, and what treatments are needed for the patient after the stent placement. How the patient needs to be positioned after the procedure and why they need to be positioned that way is important. And most importantly, what the different nursing roles and responsibilities are, from the ED RN to the cath lab RN and to the post-procedure RN. Any questions on your homework assignments?